Hey everyone, this is Chris with MedAxiom. We're going to give it just a minute for to allow some of you to register and get online. Make sure that you don't have no issues with Zoom. So we'll give it just about a minute. Okay, welcome everybody. Chris Romeo, the Senior Vice President of the Ventures team here at MedAxiom. I know we're going to have quite a few more people logging on, but in the meantime, I'd like to get this started and go through some housekeeping items. Today's webinar is called Future-Proofing Healthcare with New Staffing Models. It's hosted by one of our industry partners, locums. So a couple things to cover today, and that is that this presentation is going to be available for you in the chat feature. At the bottom of your screen, you're going to see a chat button. You can click on that. There will be today's presentation. You can download that to share with some of your colleagues or other folks that you work with, and be able to have that presentation available. Contact information will be in there as well. If you do have any questions during the presentation, we'd like to have you submit those through the Q&A feature. That Q&A feature, we will be monitoring all those questions and more than likely saving those questions for the end of the presentation. But if you think of any questions that you'd like to present to today's presenters, please do so and enter those through the chat feed, through the Q&A feature. Again, this presentation will be available. We will be recording this and be able to send this out to you after the presentation. So keep a look at it, out for it. So let's get started. So today's webinar will explore innovative staffing models in cardiology to address the challenges of an aging population, physician retirements, and the increasing prevalence of disease. Experts will discuss the role of locums, early engagement of fellows in training, and strategies to expand the locum pool. The session will also highlight the benefits of vendor management system in optimizing staffing solutions for long-term sustainability. Today's presenters will be Dr. Ish Singla, who is the president and founder of locums, our partner, as well as Kristen Doster, who is the CEO of Vemsta. So to kick this off, let me turn this over to Kristen. The floor is yours.
Thank you, Chris. I appreciate it. Happy Wednesday, everybody. It's so nice to talk to you today. We're going to talk a little bit about healthcare staffing. You know, it's one of those things that consistently ranks as a top challenge facing care delivery today. You know, whether it's we're reading our inboxes, we're sitting in the boardroom, or, you know, just in day-to-day operations. I think we've come to this realization that there's not a cavalry of physicians and nurses on the horizon ready, you know, to reach the crest and save the day. The impact is real. So in preparation to kind of chat with you today, I was doing some quick online research and just looking, very narrow focus on Q1 of this calendar year. And these were just a few of the sites and program closures that specifically listed staffing challenges as the reason for shuttering services. Again, this was a 5-second quick Google search. And yes, you know, I think we all can agree that staffing challenges in healthcare are a longstanding issue. This is not a recent phenomenon. Healthcare industry has been faced with difficulties in recruiting and retaining skilled staff, you know, for decades. I've been in healthcare 30 years, and it's been a problem that I can remember since day one. And although the pandemic exacerbated some of these challenges, the underlying issues driving it really aren't new. So I hope you all had opportunity to read Joel Sauer's recent MedAxiom op-ed about access. And when we think about access, that directly ties us back to staffing. It was a great piece, and he kind of proactively positioned this idea of access as being even more important than quality. And when we think about it, I think he's right. You know, we can have the highest quality program, but if patients can't get in our door, quality becomes really less relevant. And that access problem, though, it's really complex. Even if let's say we're awash with physicians, healthcare, let's remember, it's a team sport. And there are so many places where access can break down all along that patient journey that's going to impact and disrupt that care continuum. And just because you get a patient in the door today, if it's 3 weeks to get that echocardiogram because you don't have enough sonographers, and again, it becomes a staffing issue. And when we talk today, although we're going to kind of keep physicians at the center of this discussion, this challenge of staffing impacts our entire care team. And there's some demographic shift that we want to talk about today that's really exacerbating what's been these long-standing issues. So the data here, it's a little depressing. So maybe let's reframe it, right? And let's distill it down to something a little happier. Let's think about it in terms of birthdays. Birthdays are happy, right? Um, every day in the U.S., there are over 11,000 people celebrating a 65th birthday. That's a lot of candles if you think about it, and a lot of people with those horns and happy hats. But those numbers, when we think about them on the care delivery side, we're sometimes a little myopic. We think about them in terms of representing the panels that we serve. But there's two sides of a coin in those numbers. They represent that aging population who are going to require more health services. But those birthdays, remember, they're also inclusive of our care team. There are physicians, our advanced practice clinicians, our nurses, our nuke med tech, they're all made up of this number. And that number is going to go forward to about 2030, when all of a sudden we're going to see all of the baby boomers 66 and older, and they're going to account for about 25% of our population. So, by 2030, we're going to be facing shortages of nearly 200,000 physicians, that number about 180,000, and over 275,000 nurses. And then, that's 5 years down the road. Let's think about it today, right? Now, if we look at our physician workforce, 20% of our physicians are already 65 and older today, and they're still practicing. So this is a significant challenge. And despite those number shortages, this is the math that's working against us. There are other forces at play, and they become very cyclical, right? They sort of chase themselves, and they become really difficult to dig out of. We have this burnout that becomes exacerbated by already short teams, and that continues to be a cycle. We have this complexity of care challenge where we are seeing sicker patients and more advanced treatments, which require us to find really highly specialized skill sets that complicates recruitment and retention. And then we have this idea of new employment models, which we're kind of talking through today, and this idea of millennial expectation, which I think is fantastic, right? We see this percentage of the workforce who's showing up a little differently. It's a younger workforce. They're seeking flexible, balanced lifestyle. And those traditional employment models that we're all used to become a little bit less attractive. And that's where we really start to see, despite all of these efforts on reducing temp staffing, we see a year-over-year growth in locums utilization, and it's been consistent at about 7% per year. Even post-pandemic, that use of locums has been increasing over time. And so when we think about it, we think about how it's impacting our, fellows in training, our residents. It's a tough number to really find that exact percentage of physicians that are considering locums right out of fellowship. But there was a recent survey that was done, and it identified that, when we look at entering the workforce, about 27% of physicians started working locums tenens right outside of their residency or training. That's a pretty significant number. And so that survey went a little further to really look at why, what were the motivations to really consider an alternative employment model to rather, joining a physician practice, joining a health system. And really, some of the things those physicians cited was this idea of, what we all know, schedule flexibility and work-life balance. That locum tenens allows more control over schedule, helps alleviate burnout, improve work-life balance. Some physicians said they were looking for a more diverse clinical experience. Working through different facilities and locations through locum tenens provided opportunity to explore, different practices, different settings. And it wasn't just young physicians either who kind of responded to this survey. It was this idea of mid-careers saying it became a stepping stone as they were either transitioning between specialties or using locums to even kind of test out this better fit for a permanent position. Uh, Other things that kind of made the ranking was this idea of networking and professional growth. We all know that relationships are exponential, right? When we know people, that grows by the exponents of the people they know. And looking at locum tenens assignments is this opportunity to really, expand professional networks and build these relationships. And then finally, there was this component of giving back, this idea of taking assignments in underserved areas and, supporting this idea of medical mission. So there were a lot of motivators driving this idea of early career locums and even transitioning career locums. So now we've got this new segment of employment, right? But we have, with this theme of locums, we've become more sophisticated, I would say, in our use of agencies since the pandemic, where it was really going from fire to fire. Even especially with our frontline teams, we've gotten better. We're more sophisticated, but I'll tell you, we're still struggling with a lot of the same challenges, and I'm not convinced that we've really thought about how we play to win when it comes to staffing. A lot of recruitment happens in an organization behind the scenes. And I, from my past life, worked with my recruiters were phenomenal. They were, oh my God, they were incredible. But a lot of that process just hasn't evolved with 21st century technology and innovation. And it leaves us still dealing with this high cost of recruitment, inconsistencies in rates across agencies, even inconsistent credentialing processes. So even after going through all of this work to identify the right individuals to fill our key positions, it can take months to get them through both our internal and external credentialing slaloms. And so all of these are barriers in getting people into our organization. And because HR has a tendency, um, you know, to run outside of the operational side of the house, and then you've got recruitment that is actually then running parallel with other HR services. I don't think we always have clear visibility to what's happening in our overall spend and the cost of continuing with manual processes, and what are some of the levers that we can pull as operators to kind of manage this. So I'm going to pause there. We've got some data to process, and then I'm going to turn this over to Dr. Singla to give you some real world perspective in terms of, what's the difference between agency and vendor management software, and how do they work together to really benefit your organization. Dr. Singla?
Thanks, Kristen. Good afternoon, everyone. I'm Ish Singla. I'm interventional cardiologist by training, and I am also a locum cardiologist. And I started Pro Locums, which is a locum tenens staffing agency. We started that in about 5 years ago. So the idea behind the locum tenens staffing agency for or starting another one was when I was doing locums myself, I found that, we have facilities where there is new physicians coming every few weeks, every few months, and there is lack of continuation of care, and which is very important for all the healthcare organizations. So what we wanted to start with ProLocums was to have more of a long-term staffing programs where we have a consistent physician, same physician coming in every week or every month whenever there is a need. So with that in mind, we started a cardiology hospitalist program where our general cardiologists come to the same hospital and take care of inpatient 2 weeks on, 2 weeks off program, because that helps depending on the size of the organization, whether they have only few cardiologists or it's a large organization. The program was utilized in different ways, because if it's a larger organization, that will free up their existing employed cardiologists to do outpatient work and not juggle between inpatient and outpatient and reduce the burnout of their cardiologist. So with that in mind, we also provided the interventional cardiology staffing program where we provided more like a managed service provider. We provide 365 days of coverage at a cardiology program where we would have two physicians do 2 weeks on, 2 weeks off, full interventional as well as general cardiology coverage. So the goal for ProLocums was to start staffing programs where we have good quality physicians and we are able to pay them what they are looking for. But at the same time, as Kristen mentioned about the cost challenges. So the cost can be high and for when we have only locum physicians. So, but when we have these long-term staffing program, those staffing program provide more of a consistency to the locum physicians and also reduce the overhead for the agency. So it helps the overall cost burden for agency and provide more surety for the locum physicians and help bring the cost down for the healthcare organization. At some point we always say that, locums, we don't want to use locum, but I think locum may not be the right word. We may be looking more of a long-term independent contractors model. So, there may be physicians who want to do independent contractor work because of the work-life balance, maybe because they want to work in the rural areas, but they cannot move because of the family situations. So there could be different reasons physicians choose independent contractor model. But I think our goal as an agency or as an organization is to how we can work with the hospital and the healthcare facilities to provide that coverage for the important services like cardiology, as well as controlling the cost and bringing the quality physician and bringing the cost down. So that's where I think one of the important solutions which hospitals can use is vendor management system, because it brings the efficiency from the operational standpoint as well as logistics standpoint, how to get the physicians in the system. So vendor management system is essentially a software which is very different from most of the software which is used in the hospitals, which require big IT setup, which requires big IT integrations or implementation. So we have worked with Vemsta, with Kristen, and Vemsta is like a cloud-based software, which basically helps bring all, like a lot of agencies, like 50 to 60 agencies they have on their platform, and bring it to the health system so that they don't have to go out and contract with each agency individually, and create a marketplace where hospitals place their jobs, and they have now 50 agencies looking at that job and bring in the candidates based on the credentials, based on the rates, and the hospitals can choose the best match. And that's one of the operational efficiency which can brought on by the vendor management system. But also vendor management system provides a transparency, because you have all the locum spend by specialty, not just for cardiology, for your other specialties, for your if you're a multi-location center, whether it is a hospital or a clinic, where you are using locum more. So it overall help you strategize and then implement that strategy to see how you want to reduce the cost for the contingent staffing. You may want to spend more on certain specialty. You may want to spend more for certain physicians because they are high quality physicians. But the agencies which come on the vendor management system, they typically have lower overhead because they have kind of vendor management system act as a reverse marketing for the agencies. So they also have a reduced overhead when they use vendor management system and pass on those savings to the health system. So I think it brings a lot of different savings in terms of saving time for your operations team, HR team, credentialing team, reducing the cost and increased transparency, and helping you strategize and bringing how to have the contingent workforce. So vendor management system has typically been used for the travel nursing, because the travel nursing has been used in place for long more, has been used in probably a lot longer, as well as the need for the travel nursing has been a lot more than the physician locum staffing. But due to the switch from the employed or the private practice model of the physicians to the independent contractor model, the locum need has increased significantly in the last 5 to 10 years. And that's why one of the solutions which is being used or be adopted by the healthcare facility is the vendor management system. And the technology is going to, as in all the field, the technology, whether it is with AI or not AI driven, it is going to help with solving some of the staffing problems or the challenges which healthcare facilities are facing. So with that being said, I think the vendor management system, or the VEMSTA, is a technology-enabled platform with a focus on bringing quality physicians, or quality healthcare providers, whether we are talking about travel nursing, allied health, because it's an all-in-one comprehensive system. And whenever there is a comprehensive system, it brings the transparency for the healthcare system, where they are able to have all the dashboards, all the planning and the strategy built in, and ultimately with the goal of having, cost control for the staffing challenges so that they can continue to provide access for the patients.
Thanks for that, Dr. Singal. I think, that last slide and that idea of the triple aim, when we're on the care delivery side, we're very familiar with the idea of triple aim and quadruple aim. But that idea where the strategic use of locum tenens physicians and advanced vendor management software solutions like VEMSTA can come into play. You've got this balance with the agencies providing experienced teams to fill those critical gaps, whether they're rural markets, the idea of cardiology hospitalists to offer that flexibility, mitigate burnout through supporting your full-time teams. When we look at programs going unfulfilled, the math changes for us, right? Because it can, in those high demand scenarios, using locums can actually become the more cost effective solutions. But where we then run into challenges is this idea of managing multiple agencies without a structured oversight that leads to inefficiencies again. And what we've been talking about, kind of the theme here, this idea of varying rates, inconsistent processes for credentialing, and just overall fragmented management. By using, VEMSTA at the center, centralizing this streamlines the locum management. And it's, again, I love the idea of your conversation with this idea of being IT neutral. It's a vendor neutral platform that's going to help the team cast a broader net. It's cloud-based, so it's going to sit outside of the hospital firewall, so don't have the same obligations from like an IT steering committee. And it's really going to simplify and standardize those current operational complexities, because this is a very person managed process now. And so by adding consistencies like digitized credentialing management, we can improve compliance, we can reduce errors, and the faster we get team members into our ecosystem, the better we are operationally. Cost control is managed through standardized rates and rate caps. Again, understanding where those spends really start to build and how we can, bring on some savings, whether it's practice-based, even in bringing in perm staffing, this idea of using rates to kind of drive that margin. It's going to add impact to budgets. And then again, those dollars that are a little harder to see in terms of operational efficiencies, freeing up some of that team and allowing them to focus on other strategic initiatives, because we've cast such a broader net. And I would say the other thing that I think VMS brings to the table that we haven't had before, besides these immediate financial and operational advantages, I think there's opportunity to begin to really contribute to strategic workforce planning. An idea of succession planning in healthcare systems and physician practices, it's something that we neglect sometimes, and it's really going to be crucial for sustainability. Using our analytics partnered with internal HR data, we can then begin to work together to anticipate retirements, plan strategic recruitment, and ensure that we have the sort of uninterrupted care delivery. I think when we aggregate all of the analytics and forecasting together, we can transform how we approach workforce planning. And it's not just feasible, it becomes then highly effective. And so what does this look like, bringing it into your practice or bringing it into your health system? And this is a little unique, and having, been on the operational side of the house, it's got a different model from a software perspective. There's no setup fees, there's no monthly subscriptions, either for the agency or for the end user. It's free. It's a free software. It's provided at absolutely no cost to the hospital, health system, or practice, to implement. Other than the time that you're going to take for your team to do the implementation and onboarding, there is no cost. And we negotiate those rate caps and travel expenditures on your behalf to scale. So again, there becomes no premium for that. There's no premium for digitizing credentialing. This is all done in a very transparent model, again, with no upfront cost to the health system. And so when we think about what that means for ROI and implementing a software like this, there becomes this idea of immediate measurable wins. First, in efficiency and time savings, this idea of standardizing a process, getting more people, getting access to more agencies, rather than working with one or two. Day one, you're working with 50, but you're working with 50 all under a single contract. You don't have 50 interactions and 50 contracts to manage. And implementation of the software is, again, very straightforward. We talked about it, living environment, which is going to meet those SOC 2 Type 2 requirements for IT security. There's a likelihood that your preferred agencies are already on the platform, but in the event they're not, the first thing we're going to do is work with them to see if we can bring them into the family. And if there's some reticence, some people are less than eager to want to give up some of that, some of the margin that they make because of our rate negotiation strategies. Uh, we don't require exclusivity. If this is something you want to bring into your ecosystem, we can do a very open contract, which is going to leave you free to maintain your teams. They can maintain those existing agency relationships and do some comparison. When we think about where VMS lives in our organization, it lives in an area on the recruitment side uh, that currently is now managed through relationships. And these are very high trust relationships. They've been built over time. And we all know that, trust is good, but trust but verify can be better. And so how do we get full organization eyes on what our costs are and how do we work together to reduce that spend? So one of the things we've implemented for you, just to really get this idea as MedAxiom members, what could this look like for my organization? What could this look for my health system partner that I work with? If you're an independent practice and you really feel you're all right from a recruitment perspective, is we've created an ROI calculator. It's not visible if you visit our website, but if you go to the link in the slide, vemsta.com/ROI-calculator, you'll be able to input your current spend and run an analysis of what your costs look like and what they would look like if you would partner with Vemsta. And typically what we see out of the gate, again, through a lot of the strategies that we've talked about, is an immediate guaranteed 10% savings across the board. A lot of our partners, by year two, we've gotten to the point where we're at upwards of 20% savings. So it's this idea of efficiency translating directly into financial performance. In cardiology alone, we see roughly $675 per shift, which gives some of those programs overall 8% savings. That hospitalist programs that we've talked about, those reported savings exceeded 20% with some of our partnerships. And those are our dark green dollars, right? There's a lot of light green dollars that come from that idea of operational efficiency, from reduced administrative workloads, creating more robust financial health for your entities. So this is what the partnership looks like. And what I would say is, the results we've had so far aren't just this idea of immediate financial benefits, but this idea of sustainable long-term economic improvement and keeping our doors open and widening those access points. Implementing a vendor software like Vemsta means, predictable spend costs for staffing, controlling those spending costs, optimizing your existing resources, and all of those things are going to be critical for us in future-proofing our healthcare organizations. So I'm going to pause there. I've seen a lot of conversations, a lot of questions come up in the chat, and maybe we can work through some of them, Chris.
Thanks, Kristen. That was a great presentation and a very unique solution to some of the issues that are out there that I know all the administrators in the membership are facing. Before I get to, I do have some questions. Before I get to those, just a reminder that go to the chat feature, click on that link, and you'll be able to download this presentation. That'll also give you the link to that ROI calculator that Kristen referenced. If you do have any questions, please enter them into the Q&A section, and we'll address those. I've got a few here already. What do you think some of the barriers are for health systems in adopting the vendor management system? Clearly, it's not the price point, since there's no cost for the software.
That's a
Dr.
great,
Kristen?
Yeah, no, I was going to ask Dr. Singla if he wanted to take that. I have my own thoughts, but Dr. Singla, what are your thoughts on that issue?
Sure. I think as a healthcare provider and as a physician, we have seen the technology uptake in healthcare systems is way behind. Whether we talk about, for example, the appointment system, we are still not in this place where we can for open table, we can make a restaurant reservation for this evening. We are still not to that level. We have certain feature where we can utilize online appointments, but we are not everybody is utilization is probably like 20% or so for online appointments. So similar to that, we were pretty late in adopting any technology. And I think a lot of it might be already existing relationship between the healthcare system and the agencies. And as Kristen mentioned, it is very good to have the relationship because you want to have trusted vendors who provide you trusted physicians, quality physicians. But at the same time, if there is a software which is not exclusive and you are able to use it as a tool in addition to your existing agencies, then why not give it that as a chance and learn if there is a difference in maybe there is a reduced cost because the agencies which are on a vendor management system have a lower overhead. Maybe they are still paying the physicians the same, but they're going to charge you less as compared to some of the agencies which may have large overhead. So, and the other is about knowing about the implementation process. There is a hand-holding throughout the implementation process of Vemsta. There is full support in terms of whether, once it's implemented, there is a full support from the team, the backend team for job posting, for timesheet approval, for the invoice reviewing. So there is a lot of support which comes with the vendor management system, which the recruitment department may not know. And sometimes they worry about losing the relationship or the direct contact with the agencies when they go on vendor management system. Vemsta has an inbuilt messaging platform so that they can stay in touch with the agencies which they are working with. So they still feel they have the same capabilities of managing relationship through vendor management system, Vemsta, what they're doing without the software, but having the added benefit of, operational efficiency and the transparency.
No, I would agree with all of that, Dr. Singla. I think, we have a tendency to move at a bit of a glacial pace in healthcare, and we become very change averse. And, from, some of my past life experiences, and, again, a lot of the MedAxiom members are probably way more sophisticated, but I remember having a lot of trust in my recruitment team, and the cost almost appeared to be very fixed, and they had their relationships, and as long as we were getting good results, it sort of lived in an area of the organization because I had all these other operational fires to put out. It didn't get the attention that it deserved. And to be completely honest, again, when I was sitting on the operational side, I didn't realize there were other levers that we could pull in terms of managing travel cost, managing rate contracts, and this idea of being able to use the team to scale. I think it just never really occurred to me. When we look at adoption of VMS nationally, Chris, it's still less than 30% of health systems that are even looking at VMS. So this still continues to be a very manual process in a lot of our IDNs and hospitals and health systems across the country. And I, again, it's that idea. We see similar challenges in AI adoption as well too. We feel like we don't want to intermediate people, and not to play psychologist. I also, think that there's some fear from some of the recruitment teams, which is where we see some barriers when we start to have these conversations, because we've all been employed at a health system or open Google and do a quick search where we've seen a reduction in force and right sizing. And, we tend to feel like if we're not a part of the direct care team and at the bedside, we may be at risk. So I think there's some fear of disintermediation from some of the recruitment teams too. But that's not the purpose of software like this. It's about making people more efficient and bringing these teams more into the operational conversations, because this isn't a problem that there's a quick solution on the horizon. We don't have this massive influx of people. We still see the role, we see, look at our EP fellowship programs, less than 40% of EP fellowship, or there's about 40% gap in EP fellowships that are being filled. We don't have the workforce to fill our open vacancies. So we have to start thinking creatively and and move beyond that change adverse nature that we sort of have in healthcare.
Here's another question somebody submitted. Can you share some success stories or case studies where your team helped reduce physician burnout or improve coverage?
Yes, so I can talk about ProLocums. ProLocums ProLocum was providing locum services at a hospital in Nevada. It was a 100-bed hospital. It's not a. They have had cardiologists who left the program, and then they were using locums. And then we spoke to the CEO, and we provided the long-term coverage for 1 year till they were able to recruit permanent physician. So we implemented the program where we had saving of about 20% as compared to the locum spend. And the hospital is we are Northeastern Regional Nevada Hospital and NRH in Alco. So we provided interventional coverage for 365 days, bringing in 20% savings as compared to the locums. And this gave them enough time to recruit 2 permanent physicians.
Okay. Here's an interesting one. Can you discuss the role of VMS in succession planning for physician practices and health systems?
Yeah, I'd love to tackle that, Dr. Singla. So again, we're going to make some assumptions here in what these partnerships look like. We know with everything that we're looking at executive engagement and strategic buy-in, but if your organization is really looking to prioritize succession planning, I would tell you VMS fits strongly in the middle of the process. So again, it's sitting down shoulder to shoulder, and we're beginning to have some of these conversations with our customers now, and looking at a workforce audit and risk mapping. So this idea of pulling age demographics, tenure, turnover rates, and even your specialty shortages. And then we can use our analytics and integration to pull contract lengths, renewal rates, agency usage, and kind of develop a visual heat map showing some of your staffing risks, whether they be by specialty, by site, and putting together a timeline. And that gives us the point to really then start to focus on succession planning objectives and, defining which roles require successes in 1 year, 3 year, 5 year, determining, and this then happens on the side of the customer, this idea of determining internal promotion readiness versus there's external recruitment. And that's again where we can step in, because when we think about using VMS for sourcing, it's not just about agency staffing. It's not just about temporary staffing, and we can help with permanent sourcing as well too. So it's this idea of building these teams collaboratively. And then when we get to that point of where we really have this idea of our long-term vision, we can work with our tools to really begin to then consolidate agency usage, standardize those credentialing and privileging workflows, getting to faster onboarding, and then integrate compliance tracking and develop what I think the deliverable on that we're really iterating is this idea of a vendor scorecard and this automated locum spend dashboard. So everybody in the organization through our dashboard is going to have eyes on what this looks like. And this gets us into the sense of what I would call VMS-enabled succession pipeline. So again, this idea of using Vemster to source future staff through affiliated agencies, and then partnering on this idea of how are we using our existing teams. Again, there's a lot of work that can be done with our recruitment teams on developing these talent pipelines, whether it's shadowing, mentoring, promoting job sharing. Let's, using VMS as that sort of central data aggregation and doing it as an applicant tracking system, credentialing platform is going to free up our teams to be even more creative and, developing this idea of standardized quality succession reviews. So we're doing it at high level. We've got the model iterated. It's going to again require some rigor on the health system in terms of looking at data, but doing it shoulder to shoulder with a VMS agency, especially in that middle phase, is where we're beginning to look at 1 year, 3-year, and 5-year strategic plans. Is really where VMS software is going to make a lot of sense in these kind of future stake staffing blueprints.
It's terrific. I'll give it another second just to see if anybody submits any other questions. But in the meantime, appreciate the presentation. Very unique solution, and the VMS system looks to be something that I'd love to see our systems implement. But if you've got any questions, to reach out to Dr. Singla or Kristen, her contact information is here. I don't see any other questions at the moment. Kristen or Dr. Singla, any closing comments? I'd like to turn it over to you.
So I'll just say one thing that, vendor management system is a software to solve some of the healthcare challenges in terms of staffing. It comes at no cost to the healthcare facilities and the organization. And it's a software which is not exclusive. So consider it as an additional tool to solve some of your staffing challenges.
I'll close this out with my shameless MedAxiom plug. This idea that I know the MedAxiom members well and proud to have been one for a long time. So I really feel like this idea of succession planning and how VMS can really help us plan long term feels like a white paper to me. So I would call on some of our MedAxiom members to let's have a conversation and see if there's something there that we can really begin to partner and think about staffing solutions for the long term and look at unique solutions and maybe get some of that data published. Because again, we know when we begin to use technology to standardize processes, we get to the same place together. And that's really what our goal of VMS is here today. But we appreciate the time to talk about it today, Chris.
And again, just as a reminder, Kristen's contact information is on the screen. We will be recording this and sending this out to everyone. So keep a lookout for that. But once again, thank you, Pro Locums, Dr. Singla and Kristen, for the presentation. To everyone else, have a great day.